Goaso is the capital of the newly created Ahafo Region. It means a place of abundant resources that makes life very comfortable. With its meaning, it may be an assumption that inhabitants of Goaso live comfortably and have no challenges in terms of development, but the opposite holds true. This road from the main Goaso township leads to one of the major facilities in town, the Municipal Hospital. It is in a deplorable state, and according to the inhabitants, the dusty roads compounds to their situation.
The dusty road has affected my mother's health.
Isa Ahmed Abdullah uses this road every day to carry his passengers to their various destinations. He says the road under construction has been abandoned and the inhabitants are suffering in silence.
The
bad road is one of our major concerns.
The road infrastructure at the Goaso Municipal Hospital, a primary health facility which offers general services to the people of Goaso and its environs, is in poor shape. Also, the hospital is operating with limited infrastructure and supporting services, which undermines overall service delivery. Mrs. Samson Sakatin Namiak is the administrator of the hospital.
We need a digital X-ray now because our X-ray unit is not working now because we are using an analog system, and then we don't have even the staff to work there. We need some more staff like the radiologist or an X-ray technician, which we don't have. It's very critical.
Just like other departments of the Goaso Municipal Hospital, its emergency unit is congested, and any temporary cluster of outbreaks like malaria can overwhelm its healthcare system. The authority therefore say that expanding capacity is crucial during these uncertain times to provide quality and equal access to healthcare for the people of Goaso and surrounding communities in the Ahafo region. Walking through the corridors of the Municipal Hospital at Goaso, the capital of the newly created Ahafo Region, it was evident that the hospital, which was established over 50 years ago, has not been renovated over the years. From broken louver blades, torn and worn out wire mesh, weak and leaking ceilings, visible cracks on the floor which pose danger to both staff and patients, and poor drainage system to lack of space in most of the wards. The situation, according to staff of the hospital, impedes their efforts to deliver quality healthcare services to patients from the community and neighboring towns such as Mem, Kokum and Hwidiem. The administrator of the Goaso Municipal Hospital, Mrs. Samson Namiak, says the hospital is in need of beds, incubators, baby cots, ventilators and patient monitors. He said the emergency unit, which is an integral part of the facility, needs to be expanded to ease the pressure at the unit and also enable patients to receive the appropriate treatment from the hospital.
The buildings are also very old, so we need an upgrade or to a facelift of the facility. Last year, for example, we wrote a proposal to the GMPC to come and at least upgrade our emergency units to get more space and even maybe if possible build a high-rise building so that at least we can conserve the land and also ensure that we have enough space for staff to work.
Mr. Namiak also spoke about the dusty nature of the road, which he says is detrimental to the health of the patients who visit the hospital.
In a car passes, then the louvers, even the people who are lying there, if somebody is asthmatic, you know the trigger factor is dust. So the moment the person is lying there, and then the dust comes in, the person starts getting attacks, even though that might not be the reason why the person was brought to the hospital.
Management of the Goaso Municipal Hospital hopes the call for renovation of the facility would be a priority for government, corporate and benevolent organizations. It was for almost 1 year that clients at the Goaso Municipal Hospital in the Ahafo Region had no access to diagnostic imaging, which allows for detailed information about structural or disease-related changes. So, patients were either referred to Sunyai or sometimes much further from Goaso for such service. When the news team visited the facility in September 2020, one of the vital departments to medical care at the facility had been closed down. There was no digital X-ray machine and other diagnostic and treatment tools to determine diseases like malaria in their early stages, hence its closure. The administrator of the hospital, Mr. Samson Sakate Namiak, recounted how worrying the trend was due to the lives that could possibly be lost because of a delay in diagnosis of most diseases. He says management of the facility reached out to the health directorate on countless occasions, but there was no response. Now, there is a different outcome. The people of Goaso would not have to travel far to access radiology services. Upon GBC News' detailed report captioned "Limited Health Infrastructure, a Hidden Snare of Danger to the People of Goaso and its Environs," the intervention was prompt to the municipal hospital. A new mobile digital X-ray machine is now fixed at the X-ray unit of the hospital, and the department is in operation as expected.
For about 7 months in 2020, our X-ray, which was analog, broke down completely and we could not use it. So for about 7 months, our clients, especially the patient who needed X-ray services, had to be referred to Sunyani far away or other places for them to go and take X-ray services. It brought a lot of frustration to the clients, because living here, taking vehicle to a place, the cost in terms of money, the cost in terms of inconvenience was so high on the patient. And then even our clinicians were frustrated, because if you wanted the X-ray image to take it, they will make a decision. It delayed because we have no X-ray facilities to help you make a decision. And then people sometimes lead to blind treatment and whatnot. So the cost to the patient was so much, and the hospital was doing revenue as a result. So during the period, then GTV News came around on their usual rounds to do health stories. And they came to meet me at about 5:30 on that day, beautiful day. So when they asked me and I mentioned about the issue with the X-ray, they took it up, and when they aired the news, our Director General, Dr. Kuma Bwaji, got wind of it and immediately called our regional director, who is Dr. Bochi Boating for Ahafo Region. And then immediately tests were taken, and then we were given a brand new X-ray machine, which is by me right now. So this machine was given to us by the Ghana Health Service or Minister of Health to Ghana Health Service. In fact, what the news item did for us, we are very grateful to GBC, the Ghana Service, Ghana government, and our regional director, Dr. Bochi Boating, for the good work they've done for us. We do appreciate it very much. We also take this opportunity to thank GBC for coming and even know our problems, and then for airing for us.
the medical director of the Goaso Municipal Hospital, Dr. James Ankama, said that the value of radiology should never be underestimated in the health sector.
There was a team from DT that came to our hospital to assess the need for some of the equipment. At that time, we were down with our X-ray equipment. And for the interview, the Director General of Ghana Health Service got knowing of it. And quickly, through interaction with the regional director, they managed to get us one mobile X-ray which has been fixed in place. We want to say that we thank GBC team very much. They have been very instrumental in this project. We also thank Ministry of Health and Ghana Health Service, Director General, Minister of Health, for helping us get this X-ray. In fact, it has helped us so much. Now we have surgical discipline, another discipline that we need X-ray every day. Formerly we used to go to video and other places for X-ray, but because of this, that has been set up for us. We can take our emergency X-ray anytime, 24/7. So I want to say that we appreciate GTV so much for what they've done.
WHO estimates that more than half of the world's population does not have access to diagnostic imaging, yet it is an essential part of medical care everywhere. Unfortunately, many people in Ghana are unable to benefit from these basic diagnostic imaging services. Many ask, should this be the case? For GBC News, Oforiwa Darko reporting.